for an international fellowship and learning cannot be overemphasized. The experience that you get there, the knowledge that you get there about a specific part of your craft, and the ability to come back to whatever town you belong to and put that into practice is just unbelievable. So, couple of years ago, I was washing in at a 7:15 case with my teacher, and I was a post-degree registrar at that time, and I said, "Sir, can you please accept me as your fellow for arthroplasty fellowship?" And at that time, sir politely said that, I don't have a vacancy at the moment, but let me see what I can do for you. And in a couple of weeks, he told me, "Pranav, there's a fellowship opportunity in Korea, and would you like to go?" Just like Abhishek said, I did not have much background, and I was probably looking to get an Indian fellowship, probably put in 1 or 2 papers and then go abroad. And here sir was telling me, and that sir is Dr. S.S. Mohanty, and he's sitting here, he's the president of the Bombay Orthopedic Society. So I'm ever so grateful to Dr. Mohanty for giving me that opportunity to go to Korea and study arthroplasty in detail. So let me talk a little about the Korean experience. Chasnal and Abhishek have already spoken some ideas about these Eastern fellowships. So I was at the Cheonam National University Hospital in Korea. There are 5 national university hospitals, probably more now as well, and they have these centers which specialize in various surgeries. The 2 pictures to the right are from the Hasun Hospital. It's been voted 3rd time continuously as the best hospital in Korea. They also have a cancer and vaccination research over there. Some of the vaccines have been, for COVID-19 also have been researched there by Indian scientists. I knew 2 couples who were working at the vaccination center also. And the one to the bottom is the Bitgul Center for Joint Disease. They have a 400-bed center specialized for joint disease. They do not do anything else. They do only joint surgeries. That includes replacement, that includes arthroscopy, that includes everything, right? So why Korea? Why do we want to go to Korea? A lot of people, a lot of our seniors have gone to European countries. Even now, we continue to do so. Why Korea? Because of volume. My center, my professor, associate professor, and fellows, between the 4 of us, we used to do about 40-45 knees a week. This was when I was part of the knee team. So that's a lot of work in 1 week, and they have a 5-day week. They don't work on Saturdays, right? So the second part to it is that the specialization is joint specific. So a knee surgery department will do everything about the knee. It need not be just arthroplasty, it just not be totals, unis, no. They will do arthroscopies also, they will do meniscal transplants also. So overall, your understanding of one specific joint of your craft is going to be deadly. You will get a global understanding of that and experience in all its forms. How do you want to deal with certain things when you do an arthroscopy versus how do you want to deal with certain things when you do an arthroplasty, right? Procedural diversity. These people, the team that I worked with, and I'll come to that, they used to perform every procedure that was available in the textbook. So even if certain procedures, so when you go to a certain center, especially in Mumbai, you will see that the professor, the teacher, the boss has a certain idea of things. I don't believe in HTOs, I do only unicondylars, or vice versa. But in this center, because it was a university hospital, they used to do all procedures, they used to randomize, and eventually that's how the data used to come. That's how research used to happen. Insurance, all these people in Korea, the patients in Korea are insured. They are insured by the government and they are insured by the private companies also. Why do I want to say this? Is because more and more people accept going through various surgeries early on faster. So more primaries, more revisions, more of these things. These are university hospitals, these are teaching hospitals. Data collection and research, I'll tell you one example. One day, my senior registrar over there was presenting a case to the boss, and he said, "Boss, this patient has come after 25 years of arthroscopic ACL reconstruction." Boss was very happy because he had done that as an associate professor. So he said, "Tell me about the patient, show me the data." And they used to have a hall like this, and that's how they used to have their regular meetings in the morning. So this fellow said, "Sorry, I don't have that data." He says, "Has this patient been operated at our hospital?" He said, "No." Then, "Has it been operated at the mother hospital?" "No." Then, "Has this patient been operated in Korea at all?" If the patient has been operated in Korea, it means that it has been documented and it's there somewhere. Next day morning, promptly the entire data, photographed pictures of written statements were also available for use. That's how they do data collection, that's how they put in the research. Technology. So I'll come to that in a little bit, but Korea is very, very advanced in technology. They will use best of the materials, they will use best of technology. The center that I trained with in arthroplasty had a very high navigation device and it had a robot also. I'll come to that. Indo-Korean relations, we know that Prime Minister Modi and the President of Korea have had multiple meetings and these relations have gone very far. So they are very accepting of Indian fellows over there, and because we can speak fluent English and we can write in fluent English, they want us to come there as research fellows because they are going to publish these, right? So they are happy to have us. Access to Korea is simple. Some of these other countries require a lot of paperwork and a lot of exams. Korea does not require so many things. You can just apply, be in touch with your boss, and he'll be able to send you as well. Opportunities thereafter. So at the end of my one year in Korea as a fellow, I was in a dilemma because they were offering me a research fellowship in University of California in Irvine to go and research some planes of motion about the knee in cadaveric studies, and thereby I will get a fellowship and then I could have gone on. But at that time, Dr. Mullaji had written to me and had said that even if you come down for a vacation, come and see me. So eventually I took that option, came back to India and joined his team and worked with him for a while. And then now I'm in practice for quite some time. So common concerns which Chasnal also raised. Language of instruction. See, we certain times we feel that, Korea, Japan, some of these places may not be very conversant in English, but the bosses are. Remember, all these professors, they train like us and they do fellowships in United States and UK. So they can speak fluent English. Like you see my boss, that's Professor Yun Kyu Song. Look at the number of societies that he's been a president of. Is it possible to do that without English? No. He speaks very good English, so does his associate professor. And the language of instruction from the boss is English. Yes, there is a little bit of difficulty in dealing with patients, but that we are already well versed at dealing with patients. You need to learn surgery, you need to learn procedure, you need to learn technology. That's why you need to go there. Food is difficult, but if you can, manage a little bit of cooking, I don't think it's a very difficult problem. And for non-vegetarians, it's not a problem at all. How about the pay? During the time that I went there, they had given me accommodation. In fact, the visa and all those formalities had been done at their end. I just had to give them documents. And they used to give me an equivalent of $500 as stipend. So that's sufficient to have a normal life. And I'll club those last 2 points together, family and settle in Korea. Is it possible to settle in Korea like some of our seniors have done in the UK and the US? No, it is a difficult task. It is a difficult task, it's not easy. So you want to visit Korea, learn your craft and probably go ahead or come back. It's very difficult to settle in these Eastern countries. Here are some memorable moments. To the right and top is Professor Yoon. Professor Yoon has got some very good researches, instruments, and techniques named to him in hip surgery. And below is Professor Song, and that's us operating with the robot. That's RoboDoc, which we used to regularly use in Korea. So you harness this robot onto the knee and it does its thing. In fact, part of my research protocol was to make the RoboDoc less dependent on itself and more dependent on the surgeon. So I was instructed to work with the engineering team and the Korean fellows to help research how to make the robot more dependent on the surgeon. So that's what we were doing there. And of course, like any foreign fellowship, you get to interact with their culture, with their people. They're very warm people in Korea. They're very accepting of us. And it's a brilliant time with them. So if somebody is planning to go to Korea, I definitely recommend it. And I'll be happy to answer all questions and lead you on as soon as this session is over. Thank you so much.